You're listening to Astonishing Healthcare, the podcast hosted by Judy Health, focusing on the biggest issues affecting healthcare consumers, benefits plan sponsors, and health plans. We're covering how things truly work or don't in the U.S. healthcare system and pharmaceutical supply chain, and we're doing it in an astonishingly efficient way.
Hello, and thank you for listening to another episode of Astonishing Healthcare. I'm Justin Veneri, Senior Director of Communications here at Judy Health, and Jim Winkler, Chief Strategy Officer at Business Group on Health, is in the studio with me today. I've also got to give a shout out before we get started to Brenna Chabelle at your firm for helping coordinate this one, and a shout out for all the great research and studies you all do that she coordinates and oversees. Thank you, Jim, for joining us today.
Glad to be here and really appreciate you giving Brenna and her team a shout out. As you can imagine, this is a huge undertaking and they do amazing work.
Absolutely. So why don't you start us off with a bit about your background and role at Business Group on Health?
Sure. So I'm the Chief Strategy Officer for Business Group on Health. We are a collaboration or membership organization of employers and the industry partners that serve them, like Capital RX. Thank you for being a member company. And our job is to bring together employers and their partners to really think about, discuss, debate, and operationalize best practices in health and well-being. And so my role is to help the organization think through what comes next in healthcare. How do we take interesting insights like the survey data that we'll talk through today and really turn that into practical how-to information for our members? I've been in the healthcare related industry for, I counted in decades now instead of years because it's been so long, but a long time. I spent most of my career as an employee benefits consultant, Hewitt Associates, and then Aon after that, and joined the business group about 3 years ago.
Okay. And I always wonder, all the regional business group and business coalitions on health out there, there's no affiliation, right? Everybody's separate.
There's no affiliation. So we have a common naming mechanism that stems back to 50 plus years ago when our organization started, but we're completely independent of each other. Many of our employer members are members of relevant regional groups that make sense for their populations. We collaborate on public policy types of things, most notably, but otherwise we are operationally independent.
Cool. Okay. And your annual survey, the reason we're here, it's one of my favorite reads and is always packed with info. Can you provide listeners with a little context and the story behind it? What's the primary objective? Does that change? How's it designed? What are the demographics? Yeah. I apologize. I do this a lot, ask a lot of questions in one. So take that.
No worries. So we call it the Healthcare Strategy Survey, and that's intentional, right? So there are a lot of surveys in our industry, many that get into tactical specifics, what's your average deductible or copay or things of that nature. And those are really, really important and employers benefit from those. We take a different approach. Ours is very much focused on what are the key things employers are thinking about as they head into the next year? In this case, as they're heading into 2026, what are some of the drivers of that thought process? Often rooted in what is happening as it relates to both healthcare costs and the conditions or medical experiences that are driving those costs. So this survey, we fielded it over the summer, June, July timeframe, 121 employers with about 11.5 million lives around the world, including 7.4 million lives in the US. So it's a robust survey in terms of number of employers, but it's also employers that cover anywhere from a few thousand employees on up to 1 million employees. So a rather good indicative data set of what employers are thinking about as they deal with challenges in healthcare going forward.
Got it. High-level findings. The headline is or was obviously another year of escalating costs following 2 years of actual costs exceeding forecasts. What are you seeing or what are the respondents telling you and attributing what is basically unchecked inflation to?
Let me just spend a minute or two, if I can, on the actual cost numbers, because, as I said, I've been doing this a long time. For years and years, you could take any snapshot of a survey like this over the last decade or two, and you'll find that the height of the bars is always going up. Rarely, if ever, is a low number and almost never zero or below zero. Lots of people say healthcare costs are growing at an unsustainable rate. And I annoy our team often by saying, I've been doing this for 30 years. They've been growing at that level for 30 years. That's actually the definition of sustainability. And that's actually the problem, right? So the problem is that we're sort of numb to the actual cost to some extent. What I think makes this year's results interesting are a couple of factoids. So one, as you pointed out, 2 years in a row, 2023, 2024, employers tell us that actual costs came in higher than forecast. And that's a sign of volatility. And as bad as absolute healthcare costs being high can be for an organization, volatility is really a challenging thing. For an HR professional, a benefits professional to have to go to finance and say, hey, for the second year in a row, we got it wrong in the wrong direction. It makes it really difficult for organizations to manage overall expense. It also candidly calls into credibility. So you think about mid 2025, which is when we did the survey, employers saying, yep, another year in a row, 2024, my actual costs exceeded my forecast. Difficult situation with finance. You're now halfway through 2025 at that point. Chances are finance is not loving the credibility of your forecast for 2025. And for 2025, employers were telling us they were expecting 8% increase, 6.8% after plan design changes. So a high number that we're probably going to exceed for the third year in a row. That's certainly what I expect when we report these results next year. Is we'll have a third year in a row. And then 2026, employers basically said, hey, before they make plan changes, healthcare costs were expected to go up 9%, which is the largest single year increase we've seen in more than a decade. When you put all those pieces together, volatility, unpredictability, challenges with having to navigate your finance organization and booking a number that is really, really high, you start to take a step back and pause. When you look at 2023 to 2025 as a 3-year block, where we expect 25 to end up, it'll likely end up as the highest 3-year compound rate of increase that we've seen since 2009 to 2011. And 2009 to 2011, we got things like the Affordable Care Act and a massive migration into high deductible health plans. We saw a lot of vendor change and consolidation in the industry. We saw hospital consolidation. Big things happen when healthcare costs have that kind of multi-year uptick. And so we're really mindful of that as the underpinnings of everything we'll talk about, what employers are thinking about and what they're doing, rooted in this environment in which there is a mandate for change. Change will happen. It'll either happen strategically by employers making smart decisions about their plan and their strategy, or it will happen to them because the market will respond. But change will occur when we have this kind of healthcare cost and volatility.
Yeah, that makes a ton of sense to me. You kind of slipped and said interest there for a sec.
It feels like that. Yes.
Yeah, it's like compounding against you year on year as if it's a high interest credit card and it's just unbearable. And then that becomes like a vicious debt cycle at some point and you kind of can't get out of it. And I think it's kind of gotten that serious.
Yeah.
So our audience and your audience, mostly people in and around the pharmacy benefit space and now health benefits as we've transitioned to Judy Health, whether it's benefits brokers and consultants, plan sponsors, health plans, folks working in managed care or following managed care. I think everybody knows the pharmacy trend, what it's been, as you noted, overall volatility, but pharmacy spend rising faster than everything else. What are respondents saying and what are your thoughts about pharmacy spend as a percent of the total spend and the drivers there?
So that's an interesting one. And it honestly gets to the compounding we were talking about, right? So over the last 3 years, pharmacy as a percentage of the total has gone up from 21% to 24%, which on balance maybe doesn't seem like a lot, but keep in mind what healthcare costs overall have done over that time period that we just talked about, right? The worst 3 years in well over a decade. It really means that pharmacy costs over that time period have increased by almost 40% because it's 24% of a much higher number now. So at its core, much of the volatility in healthcare that we're dealing with overall is rooted in pharmacy. It's not just attributable to pharmacy, but it's rooted in pharmacy in that much of the cost on the pharmacy side is tied to things that are expensive on the medical side. So GLP-1s for diabetes, heart disease, obesity. Those are conditions that on the medical side are expensive to deal with and are growing in prevalence and growing in cost. And we've got a pharmaceutical treatment that's adding significantly to that cost. The same is true for a condition like cancer, right? Cancer is the number one cost driver for employers. That's what, multiple years in a row, we're seeing that in the data. And the pharmacological treatments associated with that are growing in expense as well. So it's not like we have a pharmacy cost problem, but medical's running fine. We have a cost problem on both sides, and that's what makes it really volatile.
Okay. And the report in total is 70 plus pages of data. It's just packed. And the press release covered the key takeaways. We talked about the headline cost numbers. Can you share a little bit more what's behind the curtain and not widely published from this year's survey? Maybe just 2 or 3 data points that you found particularly interesting?
Interesting question, right? Because this survey always gets widely published, and this year in particular, because of what the cost numbers are, it get very widely published. So I'm not sure that I can think of a really good data point that hasn't been talked about, but I would say there can be a tendency to just over-rotate on the absolute cost numbers and that volatility that I was talking about and kind of lose sight of some of the things that sit underneath that. So for example, while cancer showed up, as the number one cost driver now for the 4th year in a row, things like mental health jumped up. Mental health is one of the top 5 cost drivers now. So if you think back to 5 years ago, 10 years ago, we would talk about a topic like mental health and we would say, we have a foundational access issue in this country. People can't get care. for mental health, and that's a problem. The good news is we've done a lot to destigmatize mental health, and through a variety of both virtual and bricks and mortar solutions, we've increased access. Great. That's awesome. People are getting care. Guess what? That care is not free. And so now we have a mental health cost dynamic that we have to navigate. That has both medical and pharmacy applications to it, obviously. And now there's an opportunity for employers to start to think about, are people getting the appropriate care? Are they getting high quality care? Are they getting care at sort of the right level in terms of coaching versus therapy versus, psychiatric clinical care? What are all the different plot points, and how do we rebalance the system in a way that takes advantage of the access we've created, but points people to the right care? Another similar area that very underreported in the data because its absolute number is low, but jumping up, is autoimmune. So autoimmune conditions went from being about 3% of employers saying it's a cost driver to jumped up to about 11%. When we think about our top 5, autoimmune comes in 8th. So on balance, you'd be like, hey, nothing to worry about. But the reality is it has jumped up. And one reason why it has jumped up is because the treatments for autoimmune are expensive. So it may not impact as many people in your population as cancer or cardiovascular or musculoskeletal, but the cost per patient is something pretty significant. And so that's a category where we're going to pay attention to. I'll be really intrigued to see how that plays out over the next couple of years. So those are some things that I would highlight that maybe are underappreciated in all the discussion of GLP-1s are expensive and that's what's driving up cost.
Makes sense. One thing that jumped out at me, I'm wondering if you could comment on the vendor accountability piece of the puzzle here. Seemed like that became a bigger focus than I recall in past years.
I had a colleague ask me if I thought that employers historically have not held their vendors accountable. And if so, why? And I said, well, I actually think they have held their vendors accountable. I think what we're talking about is a necessary ramping up in that regard. And I think that's true sort of across the board. So in our survey, we asked about things like alternative PBMs, right? Alternative health plans. In our annual survey focused on well-being that we published a few months ago, we were asking questions about holding vendors accountable in the same way. And I think it's really, when you are in a situation like employers find themselves, with healthcare costs being what they are, the overall experience for plan participants hasn't been stellar. We've thrown lots of vendor programs and services at employees, right? So many employers have, 20, 30, 40, 50 vendors in their ecosystem. You start to look and say, all right, which of these are actually doing what they purport to do? And are they doing it well for enough people for it to be worth my time? Because I'm going to have to really dive into managing my program more aggressively. And so I think the employer message is we're going to be much more likely to scrutinize whether it's our consulting relationship, our health plan relationship, our PBM relationship, our point solution relationships, to really focus on who's genuinely delivering value that aligns with my goals and objectives as an organization, not their own, and really pushing the market toward greater collaboration across vendors in service to the employer and the employer's population, and being comfortable saying, I'm going to turn things off that really are underperforming. So I think it's taking accountability from an important fiduciary responsibility to it's that plus I really have to focus on the entities and the partnerships that really drive success going forward. And I'll dial back on the ones that don't.
And you took the words out of my mouth. I was about to say, and given the fiduciary obligations and the CAA that everybody's been talking about for years, you kind of have to get into the nitty gritty and start holding people accountable for what they're supposed to be delivering based on what you're paying them.
Self-insured employers have a fiduciary responsibility under ERISA that is meaningful and material and something they all take very seriously. Mm-hmm. I think the standard for employers, candidly, is probably less about what do I need to do to be a good fiduciary under ERISA? That's important enough. I think it's what am I doing to do my job well, to be a good steward of a program that is growing in expense, that isn't getting to and solving enough of the complex chronic conditions I need it to solve. So cancer, musculoskeletal, diabetes, heart disease, et cetera. And increasingly is creating a subpar experience for my employees, right? So at the end of the day, I want what I'm responsible for to work more effectively. So I'm focused on it from that perspective, not just because ERISA and laws that have followed that have created a fiduciary responsibility. I do that because I have to do that anyway. It's going from that to the next level.
I think this is probably a good spot for my curveball question, courtesy of Josh Golden. So you mentioned earlier your experience at Hewitt. How do you think the consulting world has changed or evolved since your early days in benefits consulting?
Really, really good question, which I hate to give Josh credit for having a really good question, but Josh is a guy. So The consulting industry has evolved in a couple of ways. I think, for starters, the degree of difficulty associated with consulting to an employer is much higher now than it was 10 years ago, 20 years ago. What employers have to tackle and what they need their consultant or their broker to help them with is much more complicated than it used to be. It's sort of not as straightforward as just take the plan out to bid every couple of years. Putting all these pieces together, understanding what works, what doesn't work. The average benefits consultant, whether they're pharmacy focused or focused on another area, medical or generalist overall, has to understand clinical things way more than we had to 10, 20 years ago. Just be conversant in topics, understand a topic like cell and gene therapy. And so I think it's harder to be a consultant from a knowledge required standpoint. And then as those firms have grown and as employers have been really prudent about how they engage consultants and where they spend money and what they want to spend money on or don't spend money on, it's just harder to grow that business as a consulting firm. And so those consulting firms have to think about different ways to serve their customers. I think in a space like pharmacy, where you all play, as it's gotten more complex, the financial engine that sits behind the pharmacy business is way more complex today than it was 10, 20 years ago. Consultants have to keep up with that. They have to adapt their models to evaluating emerging solutions, right? So you think about in the PBM world, as new solutions come on the market, take the direction of your organization as you move from, quote unquote, just a PBM to a platform via Judy. How do I evaluate that? On the pharmacy side, does it fit into the financial model that my firm has built to evaluate PBMs? How do I think about rebate-free models or transparent models versus traditional models? Like all of that, much more complicated than it used to be. So it's a challenging time to be a good consultant.
Yeah, and that's a timely comment too, given all the news recently about rebates. Kind of back to the survey and building on what you've been saying, can you highlight one or two of the themes or questions that resulted in a surprising year-over-year shift, either up or down, that you think everybody should key in on or just be aware of?
Yeah, so we don't do a lot of year-over-year comparison in the survey, not for any specific reason other than, the results each year kind of paint a picture or tell their own story. But I think some things that I would point to where we're sort of seeing some movement, things like biosimilar coverage, for example. A year ago, when we did this survey, about a third of employers basically said, I actually don't know how biosimilars are managed in my program, which in our survey last year, we called out as a learning opportunity for consultants to help their clients better understand that, for partners, vendors, PBMs, and others to better explain that to their employer clients, and for employers to need to lean into this space. This year, that number was only 17%, which is still kind of high, candidly, right? Almost 2 out of 10 are telling us that they're not sure how biosimilars work in their plan, but that's much better than it was a year ago. So that's a year-over-year change, maybe in a good direction, as employers are better understanding the opportunities that biosimilars could present for them. I think the other one that's interesting is when we asked about adoption of non-traditional or alternative programs. So not one that I have a great year-over-year trend on, but employers telling us, so in the alternative PBM or new generation PBM space, 27% of employers said that they either have it in place or will in 2026, but another 43% are considering it for 27 or 28. That doesn't mean they'll do it, but a big percentage would suggest lots of RFP activity, for example. And on the medical alternative health plan side, about 24% expect to have something in place in 2026. Another 36% saying they're looking at it. So those numbers, I would expect a year from now, we would see higher adoption rates. When you've got 43% of employers looking at alternative PBMs and 36% looking at alternative health plans, some big portion of those will adopt something. And so we'll see the market move. While it's not directly answering your question of year-over-year trend, I think that's one where I would say seeing where employers tell us they're thinking about heading is really interesting.
Definitely. And how about a practical action an employer listening to today's podcast episode? What's something they could consider or something a consultant could suggest a client look at?
So I think maybe a couple of things, some directly from the survey, some from other work that we've been doing as an organization, right? So one of the questions we ask in the survey is a hypothetical question that basically says, if your organization came to you and said, you have to deliver next year's benefits plan at the exact same cost you delivered this year, so 0% trend against that 9% number we talked about earlier, what would you do? What levers would you lean into and implement immediately? What would you strongly consider? And conversely, what would be on the, I would only go there as a last resort? The one area that employers basically said, I'll only go there as a last resort, is eliminating the current program, creating a fixed employer subsidy or contribution and sending people into the individual market. So at this point, at least, vast majority of employers in our survey, 87% said, I'm not looking at that route, even if I had to get to zero, which is an extreme case. But some of the things employers said they would consider in that circumstance, these are things that employers should be looking at in general, are things like an RFP process to narrow my array of vendors and really drive toward high-performing vendors, eliminating lower utilized programs. And then one that's maybe really germane to your audience is limit or reduce coverage for GLP-1s. And so that is an area where at the time we did this survey, only about 7% of employers said, I'm going to drop GLP-1 coverage for obesity or for weight loss next year. I suspect if we were to run this survey today, or if you were to run this survey on your customer base, you'd see a higher percentage. We've heard that at least anecdotally, more employers saying, here's something I can do right now. And that is either eliminate the coverage completely or more aggressively tie the coverage to lifestyle modification programs that hopefully help a person who uses the medications, loses weight, but then has to figure out how to kind of live differently to not regain the weight at some point down the road. So those are some of the things that I think we would say employers should be thinking about right now from the survey. Some of the things we've been talking about with employers that maybe go a little bit outside the survey would be things related to the employee experience. So one aspect of that is streamlining or making more effective your lineup of vendors. Make it more readily visible to employees where you want them to go for what. So that might take the form for some employers of leaning into things like a navigation solution or something like that, that allows you to say to your employees, we offer a lot of different programs and services. Start here always, and they'll get you to the right place. That's sort of one pathway. The other is many employers leaning into using AI to more effectively personalize employee communications around health and well-being, making it less benefit speak, legalese, SPD language, and more common person language, and using AI tools to make that part of the experience better so people can find their way to the programs and services they need when they need them. We're pretty good at explaining things at annual enrollment, but most of us don't choose to get sick the week after annual enrollment when we read all the materials, right? It happens over the course of the year and you don't remember what new program is offered or what benefit you're supposed to do, what number to call, a website there or app to hit. AI can help make that much more simplified and much more straightforward. So you see employers leaning into that as a way to navigate the experience for people a little more effectively.
That's a good one, I think. And I just wrote Samantha Custer, who's been on the show before with me, doing a transition benefits episode. It's a very niche thing, but more about open enrollment and tips employers can leverage to try to make that more of a year-round educational thing versus just an open enrollment thing and have people be more aware of the benefits they have. So that's a really good one. That's interesting. Thank you so much, Jim, for taking the time with us today.
My pleasure.
Before I get to the last question, where can people find you or more information on Business Group on Health, your webinars, your events?
Yes.
Your annual conference is coming up in April.
For sure. Our website is a great treasure trove of information. The website address is www.businessgrouphealth, all one word, .org, businessgrouphealth.org. Tons of information there. Much of it, candidly, is inside the firewall, gated for our members, organizations that choose to be members of the business group. But one of the member benefits is access to a ton of great thought leadership, ranging from innovative, strategic, cutting edge thinking to practical, tactical, how-to kind of materials as well. We do have a decent amount of information, including the executive summary for this survey and all of our surveys. That's in the public domain, so you can find that on our website. And there's information on our website about who's in our membership, how to become a member, all of that. So that's sort of the best resource to go to. You mentioned our annual conference. That's kind of our big event. It takes place in April every year. It'll be in New Orleans in April of 2026. And there's information about that on our website. Registration for that has not opened yet. It'll open in early December, but it's open to any employer. They don't have to be a business group member to attend our annual conference. For industry partner organizations like Capital RX, in order to attend the conference, you do have to be a member.
Understand. All right, last one. And keep your compliance hat on because I know in your previous roles and in what you do, you've seen a lot. So what's the most astonishing thing you saw in this year's survey or relating to this discussion today that employers are dealing with? What's the biggest eye-opener? What's the biggest reaction you've gotten from a talk you've given? That's safe to share. Tell us a good, quick story to close us out.
Excellent question. Probably the biggest aha is when you put all those little heights of the bars on the cost chart together and paint that picture of missing forecast 2 years in a row, 3 years that look as bad as it's been since 2009 to 2011, and then talking about what happened in the marketplace then. And I sort of joke, I've been around doing this for a really long time, so I lived through that period of time. I consulted with clients who said, what should I do? Should I put all my people into these Affordable Care Act exchanges when they come onto the market? Should I be getting out of healthcare? What do I do about these HMO plans that I have? Should I be blowing them up? Do I go all in on this high deductible thing? What does it feel like? And so for many benefits professionals, whether those are consultants or people in benefits roles and employers, they weren't in those roles in 2009 to 2011. This feels different. And the key message and the key conversation and where you really get that aha, like a little bit of fear, a little bit of opportunity for people is this is different than a 5 or 6% trend year you might have had a couple of years ago. We are far enough removed from the pandemic that we can't blame everything on that at this point. And that leads us to a conversation, and this is probably the biggest aha conversation we're having with employers right now, which is around this notion of being fearful of change because change is disruptive. That has generally been a challenge in our industry, right? Employers will look at opportunities, look at new solutions, look at new programs or vendors and think, this will be really hard to implement. This is disruptive to my people. And the reality is when you look at where we are in the US today, we're asking people to pay out of paycheck and out of pocket somewhere in the neighborhood of $5,000 to $6,000, depending upon which data set you look at, for a system that we can tell from the clinical results isn't treating them effectively enough. Cancer, chronic conditions, all those things on the rise, and people are consistently having a crappy experience when they do it. So why the heck are we trying to protect that system and be fearful of disrupting it? Like, we actually should lean into it and say to our employees, good news, we're going to do something different. And I know that different can mean change and that can be scary, but we're moving away from this thing that isn't working for you or for us. And so those kinds of conversations, which the survey data starts to point you toward, become the big aha that I think over the next couple of months will be a lot of the talk track in our industry.
Yeah, 2026 is shaping up to be a big year of change. So we're excited for that. So Jim, thank you very much for joining us on the show. Look forward to staying in touch and hope to have you back on. Maybe we can make this an annual thing.
Appreciate it, Justin. Thanks.
Thank you for listening to Astonishing Healthcare. Head over to judy.health and visit the Insights section for show notes and other relevant content. If you like this episode, be sure to subscribe so you don't miss the next one. And definitely share the link to this show with your network. Have a great rest of your day.